Welcome to Babs. Today we are going to discuss about the types of neoplasm and nomenclature of neoplasm. So first of all, what is neoplasm? In pathology, any word starting from the definition. So we are going to discuss first about the definition of neoplasm. So definition is, it is an abnormal mass of tissue. Second thing, it is an abnormal, excessive, uncoordinated growth, which is a purposeless proliferation of cells, even after the cessation of stimulus for the growth. So what is the literal meaning of this? The meaning is, the neoplasm, it is an abnormal mass of tissue. क्यों हो रहा है abnormal mass? Because of abnormal, excessive, uncoordinated proliferation. अगर coordinated होता तो normal growth होता. This is an uncoordinated growth. So because of uncoordinated growth, it will become neoplasm. Second thing, it is a purposeless proliferation of cells, even after the cessation of stimulus for the growth. Now, in the neoplasm, it contains two things. One is a parenchyma. Obviously, parenchyma means cells that constitute the tumor. So one is a parenchyma, the cells that constitute the tumors. And second is a stroma, means connective tissue. Obviously, अगर किसी चीज को ग्रोथ करना है तो उसे ब्लड वेसल्स चाहिए, न्यूट्रिशन चाहिए. तो न्यूट्रिशन कहाँ से मिलेगा? कनेक्टिव टिश्यू में ब्लड वेसल्स होगी तो वहां से न्यूट्रिशन मिलेगा. So here you can see the picture of neoplasm, uncoordinated abnormal mass of the purposeless proliferation of cells, even after the cessation of stimulus for the growth. Definition is very important. Second thing, one highlighted point. One highlighted point is, what is desmoplasia? Desmoplasia is the excessive proliferation of the collagenous stroma. In normally, the neoplasm contains parenchyma and stroma. But if parenchyma stimulate the stroma excessively, then the stroma becomes collagenous. And due to the collagen deposition, the gross picture, the organ कैसा होगा? Stony hard appearance हो जाएगा. So because of collagen deposition, tumor will become stony hard. Tumor becomes stony hard. So which are the examples of desmoplasia? Desmoplasia can be seen in the pancreatic carcinoma, in the carcinoma of female breast. It can be seen. Now we are going to discuss about the types of neoplasm. Neoplasm has two types. One is a benign and second one is a malignant. Benign, the name suggests, benign है, वो दयालु है, मतलब हमारी बॉडी को इतना नुकसान नहीं पहुंचाता है. Because it is a localized abnormal growth of tissue. So obviously अगर localized है तो उसका मैनेजमेंट कैसे करेंगे हम? सर्जिकल रिमूवल. So by surgical removal, benign tumor को हम ट्रीट कर सकते हैं. But malignant, the Latin word malignant means crab. Crab क्या करता है? Crab हमारी बॉडी पे कहीं पे भी चिपक जाता है. So चिपकने के बाद वहां से अपना जो भी स्प्रेड करेगा, जो भी टॉक्सिन है वो रिलीज करेगा. So the literal meaning malignant means invade and spread to the distant sites. मतलब जो ट्यूमर सेल्स है वो ट्यूमर सेल्स जहां पे होंगे, फॉर एग्जांपल लंग्स में, तो लंग्स से इन्वेड करेंगे, ब्लड वेसल्स के थ्रू जाएंगे, हार्ट में जाएंगे तो हार्ट में ट्यूमर करेंगे, अगर वो लीवर में जाएंगे तो लीवर में ट्यूमर करेंगे. नाउ नोमेनक्लेचर. In the benign, will add suffix oma for benign tumor. For example, if it is a tumor of glands, then we'll call is a adenoma. If it is tumor of fibrous tissue, then it is a fibroma. If it is a tumor will grow like papillae, then we'll call as a papilloma. And if it is a benign tumor of cartilaginous tissue, then we'll call it is a chondroma. In case of malignant tumor, we have three types. If the malignant tumor arises from the epithelial tissue, then we'll call it as a carcinoma. If the malignant tissue arises from the connective tissue, then we'll call it as a sarcoma. So what is a lymphoma? Lymphoma contain oma, but it doesn't mean it is a benign tumor. The lymphoma, it is a malignant tumor of lymphocytes. And what is a leukemia? It is a malignant tumor of blood, WBC, white blood cells. Now what is polyp? Polyp is it could be benign or it could be malignant. But what is the word meaning polyp? Polyp means any growth structures arising from the mucosa will see like a visible projection above the mucosa. You can see here, it's a mucosa. Obviously it is a mucosa. So this part, it is arising from the mucosa but can be visible, grossly visible. So it is a gross picture of colon. So we can see the here. It is a polyp, grossly visible projection. It's a histological picture. So what is the meaning of polyp? Polyp means a grossly visible projection. A grossly visible projection above the mucosal surface. It's a polyp. There are two different types of polyp. It could be sessile or it could be pedunculated. So what is the word meaning sessile? Sessile means if this polyp arising from the mucosa, if it is like this much, if grow like in the parallel to the mucosa only, then it is a sessile polyp. But what is the meaning pedunculated? Pedunculated means if this मान लो कि ये mucosa है, and if polyp grow like these, then it is a pedunculated. It has a peduncle attached to the mucosa. Then it is called as a pedunculated polyp. Okay, polyp it could be benign or it could be malignant. Now what is a mixed tumor? Normally, neoplasm has all the parenchymal cells are closely related with each other. But if the tumor contain more than one type of differentiation, means if tumor contain more than one type of cells, then it's called as a mixed tumor. So what is a mixed tumor? For example, pleomorphic adenoma of the salivary gland. It contain epithelial component, it contain mesenchymal component. So we can see the histological picture. This much part, you can see it is a tubule-like. These are the epithelial part of the tumor. And this is the stroma. This wall is a stroma. And this stroma, it is a mesenchymal component. So the pleomorphic adenoma has both the type of component, epithelial and mesenchymal. So the neoplasm contain two types of cells, two types of differentiation. Then it's called as a mixed tumor. So pleomorphic adenoma of the salivary gland is a type of mixed tumor. What is a teratoma? Teratoma means if tumor contain the cells from all three germ layers. There are three germ layers: ectoderm, mesoderm, endoderm. And if tumor contain all these germ layers, then it is called as a teratoma. But when the tumor have all three type of germ layer, it is the only condition when the tumor arises from the totipotential cells. What is the totipotential cells? Totipotential cells mean these are the cells which can rise to any type of cell. They can develop into any type of cells. They are totipotential cells. So it contains all three germ layers. It can form all three germ layers. So tumors originating from the totipotential cells, they are called as a teratoma. So for example of that, if tumor arising from the ovary or testis, because ovary and testis has a totipotential cells. So if tumor arising from the ovary and testis, then it is called as a teratoma. You can see the gross picture. It has a hair. See, it has a hair. It is an ectodermal component. So it's an example of teratoma. Now what is a hematoma? Hematoma, about different term, hematoma and choristoma. Hematoma means a disorganized mass composed of cells indigenous to the involved tissue. A literal meaning of hematoma is disorganized mass है और वो कहाँ पे? अपनी नॉर्मल जगह पे. A disorganized mass मान लो कि लंग्स में, लेकिन उसका जो एपिथेलियल वो डिफरेंशिएशन होगा वो लंग्स जैसा ही होगा. So it is a pre-neoplastic lesion. Hematoma has just a disorganized mass, nothing else. But choristoma means a heterotopic rest of cells. What is the meaning of heterotopic rest of cells? It means misplaced cells. Like pancreatic tissue. Normally pancreas में tumor होता है तो pancreas में होता है. If pancreatic tissue found in the colon, then it is a misplaced heterotopic rest of cells. Then it is called as a choristoma. Okay, so now we have learned about many things like definition of neoplasm, nomenclature, benign, then malignant. We have seen the different examples of benign tumor, malignant tumor. We have seen the hematoma and choristoma.